All right, good morning, everyone. Thank you all so much for joining us. We are going to be playing a Kahoot game today while we talk all things pharmacy. So if you haven't already, please feel free to follow the directions on the screen for Kahoot. You can do so by going to your web browser and entering in the PIN number listed on the screen. Throughout the presentation, Ernesto and I will be asking questions. So bring your competitive spirit. We're going to have some fun today. And also, if you're using a smartphone, you can also scan the QR code and join by using the app or your web browser. All right, we're going to give y'all a few minutes just to get that Kahoot login. I think we've got 17 of y'all joined on Kahoot, but we're going to give it a few minutes. If you're not able to hear us, I think some of the chat is saying that the audio is up and running. So just be sure that your speakers are plugged in and maybe try disconnecting or reconnecting those. Right, if you're just joining, I just saw your comment, Sharon. I'm not sure how I'm giving instructions to folks who can't hear us. Thanks for monitoring that chat. If you are just now joining, just be sure to join us on the Kahoot game. We're going to have a fun game throughout the presentation where we'll be asking you all some questions, and we'll have a leaderboard at the end. So who's going to win today? All right, I'm going to give it about 1 more minute. So if you haven't already, go ahead and sign up for Kahoot. And the instructions for Kahoot should be on your screen, so you can go to kahoot.it on your web browser and enter in that PIN number, and you will be able to answer questions through that. Or if you scan the QR code with your phone, you'll also be directed to the Kahoot platform, whether you have the app or if you're joining via browser, you'll enter in the PIN number and you'll be logged in. This recording will be recorded. The prizes are going to be bragging rights. So you get the health huddle, the first health huddle of the year bragging rights, if you're in the top 3 leaderboard. But if one of those 3, if the top 3 come and find me or Ernesto at Healthy County Boot Camp, then we might have a prize for you. Okay, I'm going to turn it over to Ernesto. He is going to be starting the presentation, and we'll be back. Let's start the case.
All right. I hope everybody can hear me out there in Texas land, depending where you're at. I hope y'all are all thawed out and survived the snow blizzard and everything. Okay. All right, everyone, let's go ahead and get started. Welcome to our quarter 1 of 2026 Health Huddle. We're going to be talking about some pharmacy benefits and just some things to for you to remember. We're always big with us employee benefits consultants. We want to make sure you know your tools that we have for you to know your benefits and everything. So we're going to be talking about tools, or we talk about trends, and just basically things that members that they need to know about their pharmacy benefits and everything. Um, so this is what we'll cover. Okay. Uh, we have a long ways to get there, but a long ways to go and a short time to get there. So if any of you know that song or movie reference to that, put it in the chat. We may have a prize for you as well too. Okay, so but this is what what we will be covering. We're going to talk about the pharmacy network update. We've already gone through that and everything, but it's always important to know terminology. Finding out what a formula is yes, yes, Sharon. It is Burt Reynolds' related movie. Yes, you're absolutely right. Uh, very good. Thank you for that. But we're going to go over some resources, and we're definitely going to talk about some GLP-1 information, medications, and of course, we'll end it up with questions. So throughout you can wait to ask questions in the chat box at the very end. But if you do have a question in the chat box during the middle of the presentation, we'll get to that question and answer as soon as possible and everything. But let's go ahead and we're actually going to start off with not only a question, it's kind of like a survey. We kind of want to see, get a feel what you think about pharmacy. Okay, so on a scale from 1 to 5, how confident do you feel explaining pharmacy benefits today? So please answer 1 through 5. Got 10 more seconds, please. All right. Okay. Ooh, look, as answers are coming in. All right. So we got about 30% of people right in the middle that they're on the fence whether they pretty confident or maybe they're not too confident. So thank you for answering that survey. This kind of gives us a little insight of how much we need to explain. But the thing is too, after this presentation, we'll have a reminder, but we definitely want to hear as much feedback as possible from this presentation, because this presentation is really kind of setting up to where we'll be happy to go out to the counties, to all of our member counties, and do this presentation either at open enrollment meetings. We can do a lunch and learn, or anything you feel that is needed. Let your HR people know, let your treasurers, auditors know, those who are handling the benefits and everything. Please reach out to your employee benefits consultants, because this is something that I think it's always good to know. You need to know your pharmacy benefits, because not only it's going to save the pool money, it's going to save you money and money at the county as well, knowing those tools and knowing how to use and understand your pharmacy benefits. Okay, so real quick, let's talk about the optimized pharmacy network. As we have made this change of going to an optimized pharmacy network, and you might have received letters in the mail already. But why do we make the change? Okay, so bottom line, it is cost containment. Uh, we cannot control what these pharmaceutical companies, these drug manufacturers, what they're charging for these drugs. Okay, we live in the United States. I think the United States is the only country in the whole world that actually allows pharmaceutical drug manufacturers to actually market their drugs. They're the only country that allows to do it. Okay, so this is a free market. So why do they increase costs on their drugs? Why do they do that? Because they can, right? So if there is demand for those type of pharmaceutical drugs, uh, they're going to do whatever it takes to make a profit. Okay, so just to it comes down to cost containment and everything, but we also want to ensure the network contract pharmacies are providing quality service as well too. Okay, so We did reach out to our members. We did communicate it. Navitus did notify them via mail if there was a pharmacy that was leaving the network. Okay, and we also notified the all of our members, all the pool groups during the renewal, this last renewal. All that information was in the renewal packet as well. So if you have any questions, I know we have already received a lot of calls and emails already, but if there's any additional issues or anything or any questions about any pharmacy in or not in the network, please reach out to your employee benefits consultant. Please reach out to your employee benefits specialist. Reach out to somebody on your team, and we'll get those questions answered for you. Okay. All right. So the pharmacy change, as we mentioned, there are some pharmacies that did leave our network. All right. So these are pharmacies that include CVS Pharmacy, Kroger Pharmacies, United Pharmacies, and Albertsons Pharmacies. Okay. And all these were affected on your group anniversary date. So if you are an October 1st group of last year, that's when the new optimized pharmacy network went into effect. Okay. If you were a November 1, if you're a December 1, if you're a 1-1 group, that's when the effective dates went into effect for the optimized pharmacy network. Okay. Now, what impact did it really have? We estimated fewer than 12% of our pool members, which is a little bit over 49,000 members in our pool, were affected by this change. Okay. But there was also an estimated savings that came along with that 12% disruption as well. There's about $6 million in savings to the pool, which also helped contribute towards it had a positive effect on the overall pool average increase and everything. So anything we can do to save money for our pool members, we have to do it, especially on the pharmacy side, because we cannot control that cost that the pharmaceutical companies are charging year after year, and they can get away with it and everything. And that's fine. Like I said, business is business, but we want to make sure we are putting the low net cost drugs on your formularies. And we'll talk about formularies here in just a second. All right. So your options when due to this change, members, you can still go to pharmacies that are in the network, just not the ones that I had mentioned earlier. Okay. If there's a particular pharmacy that is in question, please let us know, and we can double check and verify if that pharmacy is in network or not. But you can also still get a 90-day retail supply and participating in network retail pharmacy as well. So if you do get a 90-day supply, so remember, you can get it through mail order as well, okay? So, and that's through Costco. So if there was a pharmacy that is no longer in network, if you're able to get a 90-day supply for that particular drug, you can get it through mail order via through Costco. But if you want to pick up your 90-day supply at a pharmacy, if you want to pick it up in person, you just have to move your prescription to a pharmacy that is in network. Okay. All right. So if you have any questions, there are some resources for the employees. You can definitely contact Navitus. That's the easiest way and probably the fastest way to get answers to your questions. Any type of prescription claim questions come up, why was it denied, or what was the case may be, the first thing that we recommend doing is always calling Navitus. There's the number right there for immediate assistance. For some reason, if something just still does not seem right, please let HR know, let your treasurer know, let anybody who's handling the benefits, they will contact TAC and we'll look into it for you as well. Okay. Definitely reach out to your employee benefit specialists for any unresolved questions. They're the person to go to help answer those questions for HR and for the treasurer's office as well too. Okay. All right. We're going to go ahead and move into, if there's no any questions or anything, we're going to move into some trivia questions. Okay. So everybody get out your app and get ready to answer some questions. Here we go. All right. What is a formulary? Question. Is that a new phone book? Form? Oh, form, not phone. Okay, formulary. Okay. All right, 21 of y'all got it. Yes, the formulary is a list of prescription drugs covered by the health plan organized in tiers. So for those who are fully insured or pooled in the health pool, everyone, every county will have the same formulary as everyone else. If you are an ASO or a self-funded group, you may follow our formulary that we have, the pool formulary, but you may have a slight different one if you are ASO, because you do have that option to be able to customize your formulary and everything. So, but everyone who's fully insured will have the same formulary. Okay, next question. All right, who's the leader? TB. All right, TB in the house. Okay. Uh, let's keep going. All right. So that's just question one, y'all. So that we'll go see who the winner is at the end of the presentation. So, all right, true or false, everyone? A tier one level drug is always guaranteed to be a generic drug. True or false? It's a trick question. I didn't write that one, just letting y'all know. Okay. All right. Yes, it's false. Everyone got that one correct. Yes. So generics are not or are always going to be a tier level drugs. Believe it or not, there are some brand name drugs that are actually less expensive than generic drugs. And if those brand name drugs are less expensive, they are going to be on that tier one level. Okay, so there is a chance that generics could be at a tier two level as well. So just as a quick reminder, we're always wanting to steer people to go to a tier one drug. If there's a brand name drug that your doctor wants you to be on, if there's a generic that is available, we highly recommend it to go to that generic, because a generic versus a brand or a preferred brand name drugs, they have the same active ingredients, same strength and everything. Pretty much what you're paying for is the name. Okay, those brand name drugs that you see on TV are the expensive drugs. I wonder why generics are never televised or marketed on TV. Come on. I've never seen a generic drug on the Super Bowl. Never seen one. Okay. So just keep in mind, and that's where the formulary comes into place. And we're going to talk about formularies on how to check which drugs are on a tier one, tier two, or even a tier three level. Okay. Next question. Let's go. All right. Ooh, silver sneakers. All right. Silver sneakers. Can I ask if you're chronologically mature? I'm just asking, okay? Because I love that name and everything. So let's keep going. All right. You're up by 8 points over Tracy. So let's keep going. All right. Here we go. All right. So let's talk about some terminology real quick. We mentioned formulary. Okay. Formulary is the list of drugs that are covered on your plan. Okay. So it is a very long list. We're going to tell you where to find it. And when you do find it, when you see the list, you're going to see how long it is. So if you ever print out that list on double-sided, it's still going to be about 69 pages, 70 pages long. So I highly recommend, when you do get that formulary, please download it on your phone, download it to your iPad to your anywhere that you can have access to it when you get to see your doctor. Because when you're discussing drugs, anything that you need to be on, you have that formulary list with you so you can see how it's covered. You're going to see the different tier levels of coverage. Okay. So the tier one are your lowest cost drugs. Tier two are going to be your medium cost. Tier three are your highest cost drugs. We talked about this a little bit earlier, but as I mentioned, those drugs that you see on TV that look very cool and everything, nice pictures, but then at the very end they talk really fast about all the side effects. Okay, they do. Okay, they are marketing it. They want you to spend your money, but I guarantee you, always find out when they want you on a tier two or tier three drug. Go to the formulary, find out if there's an alternative generic drug that works just as well, but it's going to cost you less. Important, yes, you have copays, regardless of what the cost of the drug is. Our concern is on the back end, the cost of the drug, of what the claim is actually being paid. Okay, yes, you may have a $5, $10 copay, but there's a huge difference between a generic drug, a tier one and tier three, where a tier one could cost just maybe $20. okay? And then the tier 3 will cost thousands of dollars. All right. So there's a big difference there. If there's a generic available, not only saves you money with a lower copay, but it saves the county money on claims. And we want to keep those claims down because if those pharmacy claims go up, that contributes to your rates may going up as well too. All right. Okay. Let's keep going here. All right, some more terminology stuff and contaminated contaminant strategies. Pardon me. All right, but I'm sure everybody one way or another has heard of a pre-authorization, maybe some step therapy and quantity limits. As you can see in those quotations, those are the acronyms PASTQL. We're going to talk about more formulary stuff, but you're going to see those acronyms. We want you to make sure you understand what those acronyms mean. Okay, so PA is a pre-authorization. It's just there's certain criteria that the member will have to meet in order to have that drug covered. Okay, a good example of a PA could be a GLP-1 drug, and we'll talk about those here in just a second. Now, there's also step therapy. That's another big cost containment strategy is the step therapy, where the doctor may want you to be on a certain drug, but costs a little bit more. Okay. If there's an alternative that costs less, they may want you to be on that drug first before taking that other more expensive drug. Okay. Yes, and I know what you're thinking. Everyone reacts differently to different drugs. Okay. But if we can find a drug that's on the formulary that works just as well as that preferred name drug, we want you to try for any particular drug they want you to try the alternative least suspected drug before trying that other drug. Okay, so that's the step therapy. There's also quantity limits, the QL, which means that there's restrictions on the amount of drugs that you can receive in a certain time frame. And when you do have a QL beside that prescription drug name, there's going to be a time. There's going to be a time frame, and if you try to fill that prescription before that time frame, they're going to reject it. I'm just going to tell you right now. They're going to say no, no, no. Okay, so you'll have to wait till that time frame is over and get another prescription for that particular drug that has quantity limits on it. Okay. All right. So we're going to move on. I do believe we have some more questions coming up. So everybody get your phone ready. We're going to see how much you know. All right. Generic drugs are always the cheapest option. True or false? See how well you listened. Okay. I don't listen very well, but at least that's what my mother told me. I hope I proved her wrong. Mom, did I? Yes. Okay. All right. All right. You got a few more seconds here. False. That is correct. All right. Everybody got it except 11 of y'all. That's okay. All right. Let's see who's on the leaderboard now. Let's go. Viral. All right. I think I know who that is. Viral. Okay. Well, you keep going and we'll see how well who's going to be if somebody can catch you on the next question. Okay. Bull rule. Bull rule. Okay. Let's go. Let's go, Carissa. All right. True or false, guys? Everyone, generic drugs are less effective. Are generic drugs less effective? Sounds like a trick question again. False. Yes, absolutely. Yes, generic drugs are less effective. And that's not what we talked about. As I mentioned, if there's an alternative drug to a brand name drug, pretty much it has the same ingredients. It works the same way. Basically, what you're paying for is that name on that drug. It's probably been in some commercial on the Super Bowl and everything. Okay, so very good. Good job. Let's see who's taking the leaderboard now. All right. Viral is still in the lead, and MC not too far behind. And Tara from Land County. Let's go, Tara. Let's go. Catch them. All right. Catch them. And Bree, Butler, and Bree are rounding up the top 5. So let's keep going. All right. Here we go. True or false? Quantity limits can be in place for safety reasons, not just for cause contaminant. True or false? That's a long question. Quantity limits can be in place for safety reasons, not just for cost containment. There, I got the word. I said it right this time. Containment. Okay. True. All right. Great job, everybody. 46 got that. Answer that correctly. Let's go to the leaderboard and see if we've had a change. Here we go. All right. Tara's on the move. We have 12 people who are on a 4-streak answering streak. So let's keep it going, guys. Bree has made a move, and we got Tracy coming up on the top 5. Okay. All right. True or false, guys? A medication can move tiers or change coverage over time. A medication can move tiers or change coverage over time. True, very true. Yes, excellent, everybody. Yes, so a medication can change tiers. It can go from a tier 1 to a tier 2. It can go from a tier 3 down to a tier 1. Okay, a lot of that has to do with pricing. Okay, with those drugs, those non-preferred drugs, those can change as well due to new generics coming on the market. So a lot of it is market driven as well too. A lot of it has to do with clinical guidance as well. All right, so if that's why it's important to know your formulary, know where to find it, and anytime you're having discussion with your doctors is to always have that formulary with you, so that way you know exactly what tier it's going to be on, if it's going to be if a PA is going to be required, a QL or a ST is going to be required. All that's a tool for you to take with you when you're always go have that formulary with you when you go see your doctor. Okay. All right. Okay, so I'm going to turn it over to Clarissa. I know y'all are tired of hearing from me and my bad jokes, but stay hang in, guys. We have some more information and we have more quiz questions coming up. So if you do have a chance to knock out buy rule, buy rule at the end of the game. All right, take it away, Clarissa.
All right. Can y'all hear me? Hopefully y'all can hear me. Thank you, Ernesto, for all of that information. It's so helpful. I know that Ernesto talked about formularies and definitions on what tiers are, what prior authorization, step therapy, and quantity limits, but it is also really important that your employees know where to find this information. So here on the leaderboard, before we get into it, Tara from Lamb County has climbed into the first place. So way to go, Tara. And PK just hit an answer streak for 6 questions. Viral is in second place. All right, so next we're going to talk about how to find the formulary. So again, Ernesto mentioned it is a long document. And so we always want to make sure that employees know where to find this information when they are needing it. So the easiest way for employees to find the formulary, one option is by going to the TAC website. So that is county.org. Again, this is something that they can do from using their smartphone or a computer browser. It's a really easy way for them to access the formulary without having to remember their member portal login for the ESS Employee Self-Service Portal or their Navitus portal. So once they're on the county.org website, this is the home page. They will click on member services, as you can see here, highlighted in red. And then they'll toggle down to the TAC Health and Employee Benefits Pool section. If you haven't already visited our website and our section on county.org, we have a lot of resources, not just on the pharmacy benefits, but on the health insurance benefits and our Healthy County Wellness Program as well. So once they click the TAC Health and Employee Benefits, they'll scroll down to the bottom and find prescription benefits. This is going to be under the coverages and services, and it is one resource where, again, they'll be able to find that long list of medications that are covered by the health plan. Once they click on the prescription benefits, they will be able to find the formulary. There's a few different ways that they're able to view this formulary. So if first they want to understand how those prescription drugs works, the definitions of tiers or of the different things that Ernesto discussed, they can do so by clicking on Understanding Your Prescription Drug Formulary. We also have a fun video listed here on this site where they can get a better understanding for their pharmacy benefits. Also on here, you'll see that they'll be able to download the PDF or view that PDF via the full list alphabetically or by category. I personally, when I am approached with questions on if medications are covered, this is the first resource that I'm going to. Sometimes we do have employees asking where on the formulary it is and what tier that level of medication it is on. So I pull the full list alphabetically and then I just search that in my browser. So that is an easy way for employees to access the formulary and be engaged and informed with how much their medications are going to cost, but also some restrictions that might be in place. So again, that is one way that employees are able to find the formulary. It is the easy way without having to memorize login information. But all of this information that we're covering today is going to be available in the resource guide. So we did just send out another round of resource guides this past annual enrollment cycle. And we do have a full section specifically for prescription resources. Navitus has some great resources available to employees and their dependents by going to their member portal, but they can also download the app for the Navitus portal. Through this app, there's lots of features that they will be able to see. So Ernesto talked about our optimized pharmacy network. If they are having questions about locating an in-network retail pharmacy, that is something they can do by downloading the app on their phone or by going to our employee self-service portal. They're also able to do a cost comparison tool, and we'll talk about this in further detail later in the presentation. And most of all, they're going to be able to find the formulary, our list of medications that are covered by the plan. So again, this is included in the resource guide, but they're able to download the Navitus portal app and find all of those resources available to them through this. Now, within the Navitus portal, there are actually a few ways for employees to lower their drug costs. So we talked about on the Navitus portal some different resources that employees can utilize, but some of those are ways where they can actually find ways to lower the cost of medications. So first, they can compare the cost of the drugs. One really cool feature that we've heard feedback about amongst employees is that they can actually see the cost of the medication that they're being prescribed, maybe at H-E-B compared to Walmart pharmacy. So they can view that. If it's more expensive at Walmart, then the app will notify them that it's more expensive at Walmart and try to steer them to H-E-B pharmacy. So they're able to compare the cost of medications within the app, which is pretty cool. Again, any type of savings that we can make, such as our optimized pharmacy network, by making sure employees are understanding of the drug prices out there. These are all ways that we can help contain the cost of our health insurance and make sure that counties are still able to provide this option to their employees and their dependents. You can also find a less expensive generic. So this is great because if you are looking for those generic options or maybe something at a lower tier, then the Navitus app will also be able to help and assist with that. Also listed on the app, if you are taking any maintenance medications or anything that you know you're going to be taking on a daily routine basis, you can also take advantage of the convenient 90-day refills. Again, Ernesto talked about this earlier, where it still is a resource for employees through our optimized network. Um, Employees can access the 90-day prescription refill at their in-network retail pharmacy or by going through mail service order through Costco. Okay, we're going to do a little quiz. So we're going to move into our next subject, but y'all tell us, does the TAC Health and Employee Benefits Pool cover GLP-1s for weight loss? All right. It looks like 19 of y'all said no, and that is correct. We threw in a few trick questions like sometimes, maybe, and we're going to talk about that here in just a minute. This, Ernesto, I don't know about you, but this is a common question we get out there from our counties, county employees, and their dependents asking if GLP-1s are covered for weight loss or not. Okay, let's check out the leaderboard. So by roll, you are in first place. So you are climbing the leaderboard. You're back on top. Birdie, Tony, Silver Sneakers, and Jerry, y'all are climbing up the leaderboard. All right, don't worry. We're going to have a few more questions throughout the presentation as well. Okay, this brings us to our next topic. What's the buzz with GLP-1s? Again, this is something that we commonly get asked, and so we wanted to make sure that we present this topic to you all just so that you know how to approach it and how to handle it with your employees. So, are GLP-1s covered? So, the short answer is yes for those who are diagnosed with type 2 diabetes. But there is a double prior authorization in place for those medications. So if someone is diagnosed with type 2 diabetes and they are being prescribed GLP-1, the plan will cover that as long as the provider who is prescribing that has verified the type 2 diagnosis of diabetes and the pharmacist has confirmed that as well. Again, as we mentioned the formulary previously, we did take a small screenshot. This is not all of the GLP-1s, but this is an example of what you can see on the formulary related to those GLP-1s. So you will see the drug name, and this one is based off of category, but you'll see those codes that Ernesto had mentioned earlier, such as prior authorizations. So noting that that is in place for those GLP-1s. And also there is a quantity limit. So for some of these medications, you'll find here that, there is a quantity limit for these medications and you cannot refill those within a certain amount of days that you get that filled. And then lastly, on the right-hand side, you will see the tier that it is placed on. So these GLP-1s are covered on a tier 2. And so that's right in the middle of tier 1 and 3, of course. But you also will find on the formulary that some medications are not covered. So you'll see at the bottom there, NC just means that it is not covered. And there's possibly some alternatives out there on the formulary for that. So next we'll talk about why GLP-1s are not covered for non-diabetics. We have heard the hype of these GLP-1s, but it does come with a high financial cost. That high price tag actually can range anywhere from $1,000 to $1,300 a month. And with these medications that we're seeing that are advertised and maybe used for weight loss, it is a large burden that it could make on the pool if they were to be covered for non-diabetics and for the intention of weight loss. These medications, what we're seeing out there is that they are needing to be used on a long-term basis and even a lifelong use. So this high price tag can have a financial impact on the pool, where if we are to allow these medications to be covered for weight loss, then of course that increases our pharmacy cost, which in turn will impact the county in year rates throughout the year. Also, there's, as I mentioned, that potential for rate increases. So the higher this pharmacy spending, the higher the potential rate is for our pool members. So we want to make sure that we are being good stewards of tax dollars and making sure that we're covering these medications for the intended purpose of those. We are also seeing lifestyle versus the medical necessity. So we do have a few options in place for lifestyle changes that we'll talk about, some programs within Healthy County that can be implemented. If somebody is looking to, you know, looking at improving their weight health journey. So currently, the TAC Health and Employee Benefits Pool does not cover cosmetic services. But again, we do offer a variety of lifestyle and weight health programs through Healthy County. So, quiz question. Which of the following is not a weight health program provided by Healthy County? I'm sure y'all have heard of some of these out there before, but which one's not a weight health program? Think about that one. All right, good job, Rosti. So we do know that WebMD1, Wonder Health, and Omada, they do correlate to lifestyle changes and weight health. And we're going to talk about these individually. So again, since GLP-1s are not necessarily covered for the weight loss or weight health, something to keep in mind is also related to that, there's just not enough research for us to cover these medications yet. However, things that we have in place now are going to be these programs that you see listed on the screen. So Wonder Health, this is a really good program that was formerly known as Naturally Slim. This one is going to be a 10-week course. I have personally participated in Wonder Health, and I still have tips and tricks on what I use in my lifestyle, in my eating that I still take with me. This program is not necessarily going to tell you what to eat. It is actually going to give you different tips and tricks on how to eat. So I always use these examples. They sound silly, but trust me, they work. One of the tips that I take with me is sometimes, I will say that, sometimes, if you go out to eat, when you get your food, you're setting half of it aside and putting it in a to-go box so that you know that you're not overindulging when you're full. Another tip is just putting your fork down between bites. And so while that sounds crazy, it can be helpful to help with your weight health goals. So that is one program that's available to all pool members, covered at 100%. And it is a great program for employees to participate in. There are different series throughout the year, and then if you're interested in more information related to some of these programs, please feel free to reach out to your wellness consultant. We also have Omada. So Omada is going to be a 16-week course. This course is going to be a digital program that has a digital health coach that comes along with that, and a community that can help hype you up to get you where you want in your goals, in your weight health journey. The great thing about Omada is they'll send you a scale where you can track your daily weigh-ins. And this program specifically is intended for those who are at the pre-diabetic level. So again, both of these programs are going to help with weight health and chronic condition reversal, heart disease, and they have been what we have found and based off of feedback, really great programs. We also have WebMD1, which is our wellness platform that we utilize. We've got lots of great contents on there, classes, different challenges to get employees and their dependents actively engaged in physical activity. We have those quarterly fitness contests. And we also give out rewards, and you get a device subsidy once every 2 years to help purchase a tracker. So really good program to help just increase your physical activity, get you towards your weight health goals, and overall is a great program. Lastly, we have different resources within the Well on Target portal. So this includes Blue Points. They've got disease and chronic condition management programs, different self-directed courses and coaching programs. And then lastly, they do have their fitness and gym discount program. All right, so lastly, we're going to end out, before I move into that last question, I just want to remind y'all that if you are getting questions about GLP-1s, please reach out to your employee benefits consultant. We're happy to come out and do this presentation to employees. And then if you're curious about some of these lifestyle programs within Healthy County, if you're not attending Healthy Boot Camp, which we really hope you are, please feel free to reach out to your wellness consultant for more information on those as well. All right, so one final question before I turn it over to Ernesto. The scale question. So now, on a scale of 1 to 5, how confident do you feel explaining pharmacy benefits to your employees today?
Yes, 48 people answers submitted. And that's exactly where we wanted to see our numbers is 4 and 5 has increased for sure. So yes, thank y'all for participating in that survey. That really does make us feel better. Hopefully we explained a lot of things clearly and everything. There's just so much information about pharmacy and everything. It is there's a lot of things that are uncontrollable on our end, especially on how these drugs are being priced and everything. So with that said, we have some final thoughts on this, and that's where the pool comes in, and we're here to fight for y'all, to help save money. You know, I had a commissioner kind of put it to me, told me in a good way, in a great way that TAC, we're here to protect your money. Okay, we are. So that's why with our pharmacy benefit manager with through Navitus, remember it is totally separate from Blue Cross Blue Shield. So if you have an employee or yourself, go to the pharmacy and you give them your Blue Cross Blue Shield card. And if they tell you you're not in the system, you do not have any benefits or anything, I guarantee you they're running it through Blue Cross instead of the Navitus system. So if that should happen, keep calm because there's nothing worse than hearing that you're not in the system, you don't have any coverage. But that also often happens is that they're running the eligibility through Blue Cross Blue Shield than with Navitus. Okay, so with the Navitus contract that we have for all of our pool members, it is 100% transparent and a strict excuse me, straight pass through contract that we have, a PBM contract with Navitus. We are here trying to fight to get the lowest net cost drugs on your formulary. We're not trying to chase down rebates or anything like that on certain particular drugs. We work with Navitus, with our Navitus team. We also have a pharmacist consultant that works with us with our management team, and we are constantly looking at our formulary based on suggestions from Navitus and our consultant if we need to make any changes to our formulary. Okay, so our main goal is to get that lowest net cost drug, because if we get that lowest net cost drug available in that formulary, that's a lower claim that's being paid out. Okay, and that's keeping costs down as well. Okay, so the contract, this new contract, when we entered into Navitus, started back in 2019, and it has produced tremendous savings to the pool. Those savings are actually put back towards to bringing our renewals down, but that savings has come out to almost 28%, maybe even more, since we entered the contract with Navitus. So we're still pretty excited. We're very happy where we've been going with Navitus and everything. So the whole key is we can do what we need to do on our end for the pool, but we want to make sure the employees, everyone in our pool, know the tools, know their pharmacy benefits. So that way we're not trying to tell anybody what prescriptions they need to take or anything, but the tools are there for them to make the choice. Okay. And the choices are there where they can decide whether they want to go to an alternate generic versus taking the higher cost of a brand name drug and everything. Okay. So I think that pretty much wraps it up. As a quick reminder, please provide as much feedback on this presentation as possible. We are really looking at possibly, if you enjoy the presentation, we can tailor this, modify this to have it at open enrollment meetings. We can do lunch and learns, or anything specific, any type of training that you want for your employees, because this information, when you're getting a prescription on the weekend, you need to know the formulary and everything, and your HR department and your treasurers are not going to be there to answer the phone on the weekends and everything. So we want to make sure you know where to find your formularies, everything, all that good stuff. And like I said, we will be happy to notify your employee benefits consultant. Okay, and we'll be happy to schedule to, and we'll be able to go out there and take on any needs that you think the pharmacy needs. All right. So with that said, let's go ahead and see who won. Okay, so we got blue buy rule number 3, silver sneakers number 2, and number 1 is Birdie. All right, Birdie. Birdie, if you can, what county are you coming in? Are you representing? If you put that in the chat, that'd be great. Silver sneakers, if you could put the county that you're representing as well, and buy rule, put the county who you're representing. I think I know who you are, buy rule. Okay, but please put your county names when you get a chance. And if you are attending Healthy County Boot Camp or even CMRC, please come to our TAC booth and we may have a prize for you. Okay. So we would definitely love to see you at Healthy County Boot Camp and CMRC as well, which is coming up shortly in a few months for both um, conferences. So with that said, if you have any questions, please put them in the chat box and we will hang on until there are any questions. Clarissa, do you have anything else to add or anything? Did I miss anything at all?
All right, thanks, Ernesto. I think we have a few questions in the chat box. We'll try to answer those. I know that somebody asked if this presentation was going to be recorded. Yes, this is recorded, and we'll be able to get this out to you all. I think somebody asked for a copy of the presentation. Marcella from El Paso County. I know Ernesto is your employee benefits consultant, so we'll make sure to be in touch with you. Somebody asked who Navitus was. Again, that is our pharmacy benefits manager. So that's who we utilize as our vendor for the pharmacy plan. Looking through to just make sure there's no other questions.
Yeah, and Clarissa, anybody in the webinar right now, if you're not in our TAC Health pool, please reach out to your employee benefits consultant. That way we can definitely give you some more information about that. But specifically, all this information are specific to members of our TAC Health pool. So, but if there's any interest out there whatsoever, please reach out to us. We would love to have conversations to let you know what we're doing for our members to help keep costs down. Thank you.
And I see another question, where can we find information regarding the gym discounts? That is going to be listed on your Well on Target portal through Blue Cross. So if you log into your Blue Access for Members or your Blue Cross and Blue Shield of Texas portal, you can toggle over to Wellness. If you scroll down, you'll find information for the gym discount program as well as locations for that. Right, I think a lot of people are just requesting the presentation, so we'll make sure to get this recorded and posted on our video library and get that sent out to all attendees that have joined us today. All right. We'll just hang tight with a few to see if there's any other questions. I'll just submit them in the chat box, but we really appreciate y'all for joining us today. We hope you're staying warm all over Texas. It's been a crazy week, but I think one small cold weather is coming our way this weekend, but luckily it is dry, and we will hope to see you all at boot camp. Thank you all so much. Y'all have a great rest of your week.